The treatment of vertigo depends on the cause that is identified. Branded Daroff's exercises for the BPPV will help the patient to control and cure his vertigo. For Meniere's disease, restriction of salt and fluid, diuretics like acetazolamide diamox can be used. For migraine, prophylaxis for migraine has to be used. Drug treatment to control acute symptoms is warranted in severe cases of vertigo. In acute labyrinthitis and vestibular neuronitis, a short course of steroids will be helpful. In bilateral vestibular damage due to ototoxic drugs, we have to stop the offending ototoxic drug. When postural hypotension is the cause, we have to treat the postural hypotension or change the drug that causes postural hypotension. Transtympanic gentamicin, that is injecting small quantity of gentamicin into the middle ear through the tympanic membrane, and labyrinthectomy are performed in refractory cases of Meniere's disease to cure the vertigo. Vestibular rehabilitation exercises are an integral part of any treatment strategy for vertigo. Brandt Daroff exercises. These are a set of exercises to allow the vestibular debris, the otolithic debris, get deposited back into the utricle. And patients can themselves try and perform these exercises at least 3 times per day, about 6 to 10 repetitions of each maneuver for a period of few weeks, by which time they will be asymptomatic and the entire problem will be cured. Okay, for us, treatment means pharmacological treatment. What drugs do I give in a patient with vertigo? The drug of choice for vertigo, acute vertiginous episode, is meclizine, which is an antiemetic anticholinergic. It is available as antivert, 25 to 50 milligrams per oral. Next best drug that can be used is from the benzodiazepine group, either lorazepam or clonazepam. Lorazepam is available as Ativan or Larpose, 1 to 2 milligrams can be given, and clonazepam is available as Clonotril or G, 1 to 2 milligrams can be given. Antihistaminics, H1 receptor antihistamine blockers like promethazine are very effective. Promethazine is available as Finergon, given as 25 milligrams per oral tablets. Antiemetic and antihistaminic dimenhydrinate, also available as Dramamine, 50 milligrams, is a very effective drug in the control of vertigo. Anticholinergics such as scopolamine can be used, but side effects are a problem. So, scopolamine is usually given as a topical patch on the skin. It is available as Isopto 0.5 milligram patches. Calcium channel blockers like Cinerazine, available as Tugeron or many other brands, 25 milligrams, and histamine antagonist H3 agonist beta histidine, available as Vertin, 8 milligrams. These two drugs, though very widely used in our country for vertigo, are not approved in United States by the FDA, are not recommended by WHO, are not recommended by many otorhinolaryngology associations and otoneurology associations all the world over. But they are very much available for symptomatic relief of vertigo. Remember, these two agents, the Cinerazine and beta histidine, are not effective in acute stages. They take a lot of time to show their effect. So, they have to be given for continuation treatment. The acute treatment has to be managed by either meclizine or lorazepam or promethazine or Dramamine or things like that. We need to know some information about what are ototoxic drugs. The ototoxic drugs can affect the vestibular apparatus or the cochlear apparatus, or both. Aminoglycoside antibiotics like gentamicin, amikacin, nitilmicin, kanamycin, streptomycin, polymyxin, all these drugs, they affect the vestibular component. In general, they do not affect the cochlear component. Quinine, quinidine, derivatives of quinine, chloroquine, they affect the cochlear component more than the vestibular component. Furosemide, bumetanide, ethacronic acid, these are diuretics. When used in large doses for a long time, they can cause vestibular damage and to some extent cochlear damage. Anti-cancer drugs like carboplatin, cisplatin, vincristine are vestibulotoxic. Aspirin and NSAIDs, they produce tinnitus, they produce damage to the hearing component and not to the vestibular component. Ototoxic ear drops. Certain of the ear drops, particularly the polymyxin, colistin, gentamicin ear drops, when they are put in the ear, when there is a perforation in the tympanic membrane, they enter the middle ear and through the middle ear they are absorbed onto the perilymph of the inner ear and they damage the vestibular or the cochlear apparatus. So we have to be very careful in people who have perforations in prescribing these ototoxic ear drops. Now we will briefly see the other two entities, syncope and ataxia. Syncope is defined as transient loss of consciousness due to sudden reduction in the cerebral blood flow. These include faintness or lightheadedness, dizziness without true vertigo. There will be warning symptoms of pre-syncope like blurred vision, like nausea, like dryness of mouth, like vomiting. These are called symptoms of pre-syncope before the patient falls or experiences the syncope. Syncope has got a variety of causes. Disorders of vascular tone or blood volume like vasovagal syncope, vasodepressor syncope, neurocardiogenic syncope. Postural hypotension, also called orthostatic hypotension, drug-induced, especially antihypertensive vasodilator drugs. Peripheral neuropathy causing orthostatic hypotension like diabetic peripheral neuropathy, alcoholic neuropathy, or idiopathic postural hypotension. Sometimes there will be carotid sinus hypersensitivity which causes syncope. Anemia is a very common cause of syncope. Situational syncope like cough syncope, micturition syncope, Valsalva syncope are also described. There is another entity called glossopharyngeal neuralgia, and this is associated with syncopal attacks. The cardiovascular disorders that cause syncope include bradyarrhythmias like sinus bradycardia, sinoatrial block, sinus arrest, sick sinus syndrome, atrioventricular blocks, decreased left